So excited to introduce you to the great group of folks at Blueridge Dental Group. We will be seeing them on a regular basis here on LHOV, and each time we'll explore a different topic and educate you on how the do's and don'ts of good dental health. Right now we're talking a relationship and how every one of us should have a special relationship with our dentist.
When you go to the dentist, you do have a lot of choices, but I think the important thing to know is the best material to have for your teeth is what nature gives you there to begin with. And that's where dentistry may be a little different than the other professions, in that we're very preventive oriented. And what we're trying to do, and anyone going to the dentist, is to try to maintain and preserve what nature has already given you there. So the enamel that is present on the outsides of our teeth is the hardest material in our body. So that's what the dentist is always going to be trying to do, is maintain and preserve what nature's given us there. And that's where we emphasize the prevention with going to the dentist regularly, and fluoride, and brushing and flossing.
Okay, so, and I've been to the dentist. I'm so glad that I found you guys, because I'm not as squeamish about going to the dentist anymore based on a lot of things that I've heard that you folks do here. But when it comes to back teeth and front teeth, I've been lucky enough not to have a front tooth break off. I've had a back tooth break off. But when it comes to front teeth, what advice can you give us there?
Well, again, in restoring the teeth, what we try to do is to be as conservative as possible. So when you go to the dentist for your checkup, hopefully they can find the cavity early so that it can be restored at a very small stage. And if it's done that way, most people want their fillings, especially in the front teeth, to be white or light colored. Right. So the dentist will use a material, usually a plastic material called composite, to do a filling that matches the color of the natural teeth, and hopefully make it invisible. That's what we strive to do, to make it so that you can't see it. If there's a more extensive loss of tooth, then there are other materials that have to be used. The porcelain can be used, or sometimes we have to resort to doing a crown. But whatever way it's restored, right, the intention is to try to make it as much like a natural tooth in both the way that it looks and the way that it functions.
So the point being that you will take care of us no matter what, and I think that's what people want to hear, is that whether it's front tooth or back tooth, you're going to give us the best options possible. Now, what about back teeth? I have a broken back tooth, and it's not quite finished yet because I left the area where I was having it worked on. What do you offer there? Okay.
Well, back teeth, it's really the same consideration to try to maintain and preserve as much of the natural tooth as possible. Okay. There's a difference, though, in materials, because the function of our back teeth is different than the function of our front teeth. Okay. And we use the back teeth mainly for chewing or biting. So the emphasis there will be to have materials that are stronger. So in the back teeth, we can still use plastic or composite if it's a very small lesion, but many times we will go to materials that are stronger, so with metals, or doing some type of porcelain ceramic, or porcelain ceramic and metal.
So it sounds like there are many, 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 many ways that you can approach any one issue when it comes to teeth. But you and I were talking earlier, and you really recommend that you sort of build a relationship with your patient, and you kind of come up with a plan together, right?
That's correct. And people ask a dentist, they say, how can you do this every day and work in people's mouths and look at teeth? But what makes it interesting is that everybody's different. So the demands for each patient is different. So the key is in doing the proper diagnosis to find out what works best for that patient. And our goal and objective is to help everyone be healthy throughout their whole life and maintain their teeth for their lifetime.
Kind of build a relationship and sort of watch us as we grow up and get older and take care of our teeth.
That's right. And a nice smile and a good bite, that's the best advertising that you could ever have. So that's what we're trying to do, is get everybody healthy and smiling.
We will be having more segments from the folks at Blueridge Dental Group. This particular office, though, is located in Hardy there at Smith Mountain Lake. They're great folks. Just so excited to be working with them. Give them a call if you'd like to check them out, 540-721-2448. Plus, you can always go to blueridgedentalgroup.com. So happy to have them on.